Hello, everyone. My name is Lori Orlov, and I'm an industry analyst about technology for older adults. I'm going to be talking to you today about the U.S. market of that technology. I've been an industry analyst since 2008. Previously, I was an analyst and a research director at Forrester Research, and before that, I was a chief information officer. Today, it's important to understand how the context of COVID-19, the coronavirus, how that has in fact changed everything, and particularly changed everything for older adults. It has severed their connection between families and isolated older adults. It's boosted the need and demand for and explosion of use of telehealth. It's created a pressure on families and care providers to find ways to address loss of in-person everything. And finally, investors also see the opportunity to invest in these categories of technology for older adults, particularly expanding the ability to interact, including use healthcare capabilities remotely. So let's move to the next slide. So what I want to describe to you here is the context for thinking about older adults. Right now, today in the United States, there are 54 million people age 65 plus. Only 2.5 million of those people live in senior living, that is, assisted living, independent living, and skilled nursing facilities. For example, 1/5 of the Florida population is 65 plus. 22% of older adults age 75 plus need help with personal care, and 5.8 million older adults have Alzheimer's. Most of those people are over the age of 75. The other context that is important to understand is the cost of home care and senior living are now roughly equal. That is, if you had 24/7 home care, it would be the same price as the average price of assisted living, approximately $4,000 a month. The demand for care workers is up, and it's very competitive. There's a scarcity of resources. The same companies are now competing for people like Walmart, home care, home health care, and senior living. It's a low-wage job, and there's a scarcity of the people who are willing and able to do it. So taking a look at a little bit more context. Today, life expectancy at 65, independent of chronic conditions, is getting longer and longer. For women, it's approximately 87. For men, it's approximately 85. The higher life expectancy for women is based on income, and it's particularly higher for people who have been professionals. The net worth of individuals age 75 plus, including their home equity, is $200,000 total, which is not enough for more than a few years of senior living. So let's take a look at the next slide. So given the context of what I've just described, as people age, their needs for support move along a continuum. So starting at the left side of the screen, when they're most independent, the kinds of technologies, even if they're living alone, include having an alarm system, in-home cameras, perhaps smart doorbells, and as they develop any chronic conditions, the ability to remotely monitor them and or their chronic conditions. Further along this continuum, it's important that these individuals have access to the communications technologies that make a difference, including email, phone, including smartphone, video, chat, and voice-first technologies. That is, the ability to speak a request to a technology versus having to type or swipe it. Then, as they become a little bit more frail, they may be interested in technologies for personal safety, which can include technologies like the mobile personal emergency response system, which is now potentially a wearable on your wrist. It includes fall detection capability, motion sensors, and for those who are having memory loss, the ability to set a geofence, that is a set of location boundaries around which a person can move and beyond which someone is notified that they have in fact moved outside the boundary. And then in the personal health technology category, people, as they evolve over time, need more in the way of assistance, including medication reminders, dispensing of dosages for medication, a new category of technology that is not quite hearing aids called hearables that enhance the ability to hear, wellness applications, and wellness guides. And finally, as people's health status evolves yet further, they may benefit from chronic disease monitoring, including on mobile phones, but also with information transmitted to physicians, remote patient monitoring, telehealth, and even reimbursed hospital at home. So the market overview of 2020 that I published in March, which you could take a look at on my website, ageandplacetech.com, that market overview underpins the role of family and caregivers to interact with the categories of technology for older adults. So I just described them in an evolution sense over time, and this is the subcategories of technology that make a difference in one's life. And particularly, they're described as a puzzle because we need all four parts of that puzzle to age successfully. So on the top left are the communication and engagement technologies, which include the ones you see here, recently added smart speakers, voice assistants, and as I just described, hearables. On the right side, you see the technologies that help keep us safe in our homes and when we're out and about, including home security technologies, a growing collection of smart home technologies, wearable personal emergency response systems, voice-enabled help, webcams, fall detection, home monitors, and inactivity monitors. So if someone doesn't move, we're able to detect that as well. The bottom right are the health and wellness applications, and there's a growing list of those as well. The mobile health applications, telehealth I just mentioned, contact tracing, medication management, disease management, fitness and fitness trackers, voice assistants again, and wearables. The bottom left are the technologies that help us age successfully by keeping us able to learn new skills, to learn the skills that enable us to keep working, to leave a legacy to our children, and to be able to volunteer. And in addition to that, there's a growing category of technology called fintech that enables us to help maintain our financial well-being. And in the center of this puzzle, you can see that's where the role of families and caregivers play. And it's in the context of all of these application categories that families and caregivers make a difference. So what is voice first? Let me talk about that a bit and tell you why it matters in the time of COVID-19. So with voice first technologies, isolated seniors can speak to devices and hear a response. And this is a breakthrough technology, probably the biggest breakthrough in terms of user interface since the invention of the browser. Today, the Alexa device, the Alexa application, a voice application, is on 100 million devices, and Google Assistant is now on 1 billion devices, which includes smartphones. Half of all smartphone users are interacting by voice today. Voice has become established as a primary interaction method in some new cars using Apple CarPlay or Android Auto, and increasingly is likely to be installed as part of the car that you may buy that is new. Voice is a fit for seniors with dementia. And aside from the fact that you can have scheduled reminders, you can answer questions repeatedly without ever getting bored. You can ask a question repeatedly without ever getting bored, and the device will answer without ever getting bored. And you can also have access to some new technology that has been rolled out recently, Care Hub from Amazon, which came out in September, which has more of an ability to connect to devices that monitor well-being for an older adult, including the ability to actually speak the fact that you may have fallen and can't get up. Increasingly, voice is useful in healthcare and enables a hands-free interaction in hospitals and for doctors' notes. And some people are experimenting with hospital discharge instructions. Most recently, 80,000 medical terms have been added to the Amazon Alexa environment through a partnership with a digital health company that gave them all of those new terms. So that means you can ask a lot of questions about various symptoms and possible illnesses. little bit more about it. Why does it matter for older adults? We talked about the fact that it enables you to answer questions, but also that this is a mitigator of social isolation. That is, if you are stuck at home in your home and or in senior living and are unable to get out, you can speak, get an answer. You can play music. You can have audiobooks read to you. You do not need to fuss with complicated controls, and it will tell fun jokes and riddles. It will look up information about anything and enable you to do things like call my daughter, and eventually we'll all be able to ask, are our prescriptions ready? And ask about a symptom that we may be interested in learning more about. And eventually we will have skills that are tailored to individuals who are in specific senior living communities or admitted to specific hospitals, getting answers to questions about for simple things like what are the hours of such and so, but also, where is the doctor and who is the doctor? So one of the things to understand about voice is to what is the prevalence of use of it by older adults. And what this slide shows is that we're not quite there yet about learning more about specific providers, but we are there in terms of older adults asking questions about symptoms. Older adults are particularly concerned about privacy and a device that is always listening. Older people are willing to search. They're less willing to use voice technology to communicate with other people or to issue commands. And they may also be less willing to take their personal interests and preferences into account. Over time, our interactions with voice assistants are going to vary based on our trust. That is, do we trust the device? And are we interacting with trusted providers and partners and organizations that can help us? And it moves along a continuum from the least trust required to set a reminder, a timer, or play music, and along the continuum to engage, interact, and personalize. Particularly, that's ahead of us. We're going to definitely see more around personalization, and I give these examples. And in terms of supporting us over time about our specific chronic disease, about our specific access to mobile health technologies, digital health technologies, and a telehealth interaction that is a trusted interaction with a healthcare provider. So in the hearing context, hearing aids and hearables and captioning are all disrupted markets these days. They've moved to a stage of not always requiring an audiologist. The FDA has allowed marketing of self-fitting hearing aids in 2018. And so you can actually go online, take a hearing test yourself, identify the type of hearing aid you may need, and in fact, purchase it online. This has created price possibilities which will expand the population of users. Furthermore, hearing aids now have the capability to detect whether you fell, and more importantly, they have the AI capability to learn about your behavior over time. You can adjust your hearing aids now through smartphone applications, and you specifically can adjust the hearing aid for a specific location you may be sitting in. With hearables, you can enhance the sound, whether it's through headphones or earbuds, in a variety of settings, which has emerged to help those with mild to moderate hearing loss. And finally, captioning and captioning telephones enable those who can't hear to have conversations with those who can't. That is a service that is typically provided by people hearing the conversation and making it accessible to the person who can't hear, turning it into a caption. So now I'm going to talk a little bit about the future of remote care technology in older adults, which is research I'm currently doing that will be published in December 2020. I interviewed 27 companies for this research and 30 executives, including those from Microsoft, Best Buy Health, Home Instead, AARP, and a wide variety of other companies, including startups in the telehealth space. So what's obvious about COVID-19 is that it has disrupted our most valued interactions and has done so especially in skilled nursing facilities and especially with families. It has broken the in-person connection with healthcare providers, causing the loss of treatments, follow-up, and provider income. Actually, many doctors have lost significant income during the pause of interactions that COVID represented. It has halted in-person social experiences and has contributed to the isolation of children, and particularly of the inability for children to go to school. It has exacerbated untreated health conditions and has particularly created a world of people who are not addressing cancer screenings, mental health issues, and untreated strokes. It has produced social isolation and loneliness in unprecedented levels, and for senior living residents or seniors living at home, they have become isolated and fearful of going out. And finally, it's accelerated the need for high-speed internet access for all, and many older adults lacked the Wi-Fi technology to benefit from use of the internet at home, including access to telehealth. Hopefully that will be mitigated in the near term. So what will be different? The telehealth role in 2020 has been scoped by the Center for Disease Control in Atlanta. The CDC reports the growth of telehealth visits through May of 2020, from in-person visits to canceled appointments, to telehealth using all technology methods that can be reimbursed, including the telephone, and stabilizing in April, where the proper role will be evolved to an appropriate mix of in-person and online access. COVID-19 required companies to be creative on how people interacted. And so Microsoft provided a chatbot that was put on the CDC website to respond to COVID-19 questions and reduce the visits to the emergency room during the early parts of the pandemic. And in fact, there were 500 million uses of those chatbots worldwide. It's created and enabled the growth of voice technology for doctors to dictate orders or for individuals to have their adherence driven to the regimens that they're supposed to follow. It's created remote visits as part of the mix of interactions with doctors. So some interactions require in-person, and now some doctors are agreeing that some interactions can be done remotely. It's enabled contact tracing using wearables, so we can know where people inside a building and outside a building may have been. So we can, in fact, track whether they've encountered somebody who actually has the virus. It's created a mandate for the improvement of tech infrastructure for older adults, and particularly for seniors. And it's enabled much more interest and use of care in the home and even hospital at home. Some examples of COVID-19 technologies that during the early parts of the pandemic were enabled as free to individuals. These are some of those. AARP was involved in this. It's Never Too Late. And Google Assistant, How Can I Help? All kinds of ways of enabling people to access family members as well as information. Others have since then improved or launched a senior focus on technology, including Amazon's Care Hub, which I previously mentioned. Voice-enabled capabilities have grown in interest and use during the pandemic and will extend beyond, including smart home capabilities that do not require a person to interact with a device or a particular step in the home to get something to happen. This is the remote care context. And these innovations are eliminating some amount of labor in the home, including the voice first devices, but also video doorbells, home security systems, the ability to detect a fall without a wearable using radar or sound, and home security offerings, which I've noted often for 46% of the women age 75 plus who live alone, home security offerings that are simple and easy to use will be of great benefit to them. There are both home security offerings that come from services and also do-it-yourself. And finally, the ambient technologies, that is the sensor enablement of the home, is a growing possibility for automating many tasks and making a home more appealing to live in. So in January 2019, the Consumer Technology Association sized the market for technology for older adults. And they said that by 2022, the active aging forecast was going to be $29.9 billion. But I would argue that the pandemic has reminded us that technology that is designed for all people can be tailored for older adults, and that should not be a specialty market that is a niche market of hardware, but rather the market of all hardware and tailored and customized software for older adults based on their specific situation and circumstances. So I want to thank you for letting me speak today about this topic, and I look forward to learning more about your interests in this subject.